Did you know that in 2006, there were over 380,000 medication errors in hospitalized patients? And 25% involved computer informatics. Miscommunication between pharmacists, nurses, and doctors is a common cause of medication errors. This is the population that needs a technological tool. We're aware of the following causes of medication errors: incorrect technique, incomplete orders, data entry errors, knowledge deficit, misinterpretation, and failure to recognize contraindications or drug interactions. We're here today at Cherry Medical Center. We have an interdisciplinary team of a nurse and a physician working with one patient, Mrs. Miller. Mrs. Miller was presented at the emergency room with chest pain and has been diagnosed with STEMI, tachycardia, and hypertension. The doctor is ordering a new prescription to be given STAT. Watch this scene as one example of what can occur.
Hello, Nurse Marcy. This is Dr. Stone. I'd like to add the following medication to Mrs. Miller's MAR. Her date of birth is 1/20/36. We need low pressure, Q 6 hours, at a dose of 25 milligrams. First dose to be given STAT.
Okay, I got it. I'm on it. Thank you, Dr. Stone. Okay, he didn't tell me the route. Gosh. Well, Mrs. Miller is kind of in a critical condition. It's got to be IV. Mrs. Miller, what's your name and date of birth? Okay, very good. I'm going to give you some medication, okay? The doctor ordered this. It's going to make you feel so much better. Okay, good. Little flush, medication. Good. I'll be back, okay? Hi, Mrs. Miller. How are you feeling? Mrs. Miller? Mrs. Miller? Mrs. Miller, code!
This could have been avoided if I had specified the PO route of the drug to the nurse.
Or if I had looked up the medication in the Davis Drug Guide. Knowledge deficit could be addressed by the RN with the use of a PDA clinical decision support application, such as Micromedics or the Davis Drug Guide, as mentioned by McHugh in 2011. To prevent these incomplete orders, the doctor could also use a PDA to dictate the medication order, which is then sent wirelessly to the pharmacy and the nurse. Data entry programs can define parameters for acceptable values. When professionals enter unacceptable values, they can't progress further into the program and they get a warning message. Watch carefully as the new technology prevents such sentinel events from occurring and improving interdisciplinary communication.
Medication order for Mrs. Evelyn Smith, date of birth 1/20/36, 25 milligrams, low pressure, 4 times a day, first dose STAT.
Order cannot be sent to pharmacy. Route missing.
Route is by IV.
Order error. Route and dose incompatible.
Route is PO.
Order complete. Notifying pharmacy. Notifying nurse.
Interprofessional communication among healthcare team members is enhanced by technology safety checks that reduce medication errors. Here are some informatics challenges with our tool. Trustworthiness. Privacy is in question if the doctor is using the device in a public area. The doctor will need some kind of confirmation from nurse and pharmacy. Alerts will be built into the PDA software, which recognize whether the order is complete and the dose is route appropriate. A challenge will be setting the parameters so the alerts are valid. If too frequent, they will be ignored. Administrative needs. The dictation PDA could be integrated into a closed-loop system that posts the new order to the MAR and adds it to the patient's account for billing, in addition to notifying the nurse and pharmacy.
This PDA interface is a new software, but it's actually adapting it to current technology, which is easily implemented. An example of human-computer interface mismatch would be if the doctor has to wait for prompts or his accent or speech patterns are not recognized by the software. UAMC utilizes some of the most current nursing informatics technologies. They have an EMR, special intercom phones, and Pyxis machines with alert error messages. These technologies, if integrated together, could present even greater patient care solutions. The future implications of this technology is that it can serve as a teaching tool for both PCPs and nurses to improve medication safety. If the software could interface with a patient's EMR, it could evaluate new medication orders to check for allergies, contraindications, and drug interactions.